question. Yeah, my first question is, United States is still in serious pandemic, and some Europe countries also in pandemic, and as well in the chaos. China, the capital of China, Beijing, now is facing the new wave. So what's your prediction and analysis on the global pandemic situation, and what will the situation influence on Malaysia? Thank you.
Thank you very much. We are following the situation, the global situation, very closely, and certainly there's an increase of cases in other countries. But what is more important for Malaysia is that first, we need to strengthen our border. So if we can do that, then we can assure those coming to Malaysia, then citizens coming back to Malaysia, then we have to quarantine them, and we isolate them and quarantine them, and we swab them as well. So to make sure that there's no infection from outside coming into Malaysia. So if we can contain the infection locally, and if we can control our border, then I think we can control the virus in this country. But more importantly is that the strategy that we have, it works whereby we started with MCO. So although our cases is less now, but our activity of surveillance and testing will continue. So if we can detect a cluster, for example, then our EMCO activities will be implemented. For example, even though we are in RMCO, recovery MCO, but if there is a cluster of outbreak, then we will implement our enhanced MCO in that region or in that place, and make sure that we screen everyone. And there are two things that we have done it differently from other countries. Number one is that when we identify someone positive, whether it's asymptomatic or mild symptom, we will isolate them and treat them in our hospital. If they are asymptomatic, we also will isolate them in our hospital. Second is that those Malaysian returnees coming home, we make sure that we quarantine them. In the past, we started with quarantine at home, then we have a compulsory quarantine in our quarantine center. Now we are going back at home again, but it's still compulsory quarantine for 14 days. Then we will do the swab day 1 and day 13. And if they are positive, we will isolate them. If not, after the 13th day, then we will issue them a certificate that they are free back to the community.
But how about the food safety, especially the imported fresh food? Because in China's Beijing second wave, it is estimated maybe some fresh fish food has some problem.
So far, we have no issue with fish because when we cook our food, then the virus probably, we have not heard of a transmission from the virus from the food. So because we cook our food, so the heat itself will kill the virus. So I think we have no reports with regards to transmission from the food intake. So, but more importantly is that for us to take all the precautionary measures and maintain a good personal hygiene.